Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. I'm somewhat smiling from ear to ear. I have to say that I've just been spending some time with Nigel, who's here with us today. But I'm here to tell you a little bit about our Gold Labor and Delivery Symposium. That's right, folks. It's coming up this year, and I want to tell you a little bit about it right now before we get to talk to Nigel. He's going to be here speaking on one of my favorite topics. So we're going to be live on October 7th. You'll have access for 8 weeks to our Labor and Delivery Symposium, and we can't wait to share all of the great topics. We also have an open access, a free public keynote as well, which you'll have an opportunity to come in and register for. Right now, that's absolutely free and exclusive to all of you listening in. So make sure you do that. You can head over to goldlearning.com right now to check out all the details. And we're going to be so excited to see all of you there, of course, as part of all of these presentations. Well, here we have Nigel Lee with us here today, and I just had an opportunity to listen to Nigel's presentation, which is absolutely fabulous. It's updated information, and I'm going to ask Nigel to share on it. But Nigel, welcome back to Gold. It is so good to have you back here at Gold Learning.
Oh, thank you.
Yeah, and you have been busy. So, well, as always, I mean, I know you fill your time but you've been busy in the area that we're going to be talking about. You're going to be sharing about one of the things that, of course, is near and dear to your heart, and that is sterile water injections. So Nigel's presentation title is Sterile Water Injections for Managing Back Pain in Labor, Evidence, Techniques, and Implementation. And I guess I'm teasing everybody because the busyness that has incurred is you've been doing some further research into sterile water injections. So just tell us what has been happening in this area, because it seems like you're always stirring up a little bit of controversy, Nigel, wherever you go.
Oh, I'm not sure we try. That's not our aim, but it does seem to happen that way sometimes. I think so. We've been doing water injection research for nearly probably 13, 14 years now, and really trying to bring water injections out of that, something that midwives have been doing kind of surreptitiously under the table, and bring it out into the fore and provide a good solid evidence base for it, and look at different techniques in which it's going to be the most effective technique. So we've done quite a bit of research around that, and we've done large randomized trials that have demonstrated that water injection does work, provides evidence for efficacy and safety. And more recently, we've kind of been branching out to see, well, can we use this for abdominal labor pain? So we've recently completed a study around that, and also looking at addressing the one main negative side effect of water injections, which is the injection pain. So looking at ways that we can actually mitigate that without impacting upon the analgesia. So really trying to sort of bring water injections out to the fore and so it can be used as a mainstream form of analgesia and available to women worldwide.
Yeah, absolutely. And like you said, it's been around for a very long time. I have to say that I have been very fortunate to see it used. It was actually with a family doctor that I worked with, and she was very keen to use it all the time, but didn't have two people to do it, which is what you recommend when you're putting it in, is to have two midwives or two nurses, labor nurses, injecting at the same time, correct?
Yes, it is. Yeah, we've demonstrated that 4 injections is probably the most effective technique, and really just to efficiently and effectively give those injections between the space of a contraction. Realistically, you would need two, or it's better to have two practitioners there at the same time. Doesn't mean you can't have one, but it just makes it more efficient in terms of not only giving the injections, but for the experience for the woman as well.
There was a few things that really surprised me actually in this presentation, because I kept thinking, what am I going to learn more? But you did surprise me with a couple of things, and that was how to reduce pain in having the injection, and maybe what the importance of this and the efficacy of maybe using it again, or even, how people felt like it was how the practitioner might feel about giving pain. So I hadn't really thought about, honestly, hadn't thought about any of those things because I'm all about, actionable items to reduce the overall pain. So in my head, I'm getting to the goal of what, the actual stimulation of the sterile water injections does. So that is really interesting to me, but it feels like it's more robust when I hear that, obviously. So I'm very pleased. I won't share obviously what you did and how you did and why, but that's just really a bit of insight. So tell me when you were doing this research and you were building it out, was this did you the way that you built out the research this time, was it because of all of the feedback that you've learned over the last 13 years?
It is, and I think it was also part of the approach that we chose. We often choose a what they call a mixed methods approach. So we're looking not only at that quantitative, does it work or doesn't, and can we get the figures to demonstrate that, but also taking a bit of a deep dive into the experience of women receiving water injections and how they feel and what their attitudes towards it are. And as you mentioned, looking at the clinician's response as well, because they're the ones who are going to have to talk to women about the procedure. They're the ones who have to deliver the procedure. And do they find it a positive experience? Are they motivated to do it, or do they have reservations about using the procedure?
Yeah, absolutely. And you even mentioned that in terms of it really is sort of somewhat of a simplistic tool that we have. It's easily accessible. Everyone can do it. It's easy to learn. But the implementation has been much harder than you ever thought it would be. Like, talk to me about this.
Certainly, well, certainly harder than we would like it to be. You'd always like this to be, you always kind of hope that everyone will kind of embrace this, run away with it and just do it. But the practicalities, I think, of our health systems and, various sort of multidisciplinary attitudes do make, I think, introducing these sorts of procedures, or even just sometimes promoting new midwifery procedures, a bit more challenging.
Right.
And as you mentioned, certainly the simplicity of the procedure sometimes just seems to kind of work against it. If it was a little bit more complicated, if we had, we tend to be fairly scientific people, so if we had something that we kind of grasp more scientifically, then maybe that would make it more acceptable. But it is deceptively simple, and the upside of that is that it means that it can be used pretty well anywhere that you can have an ampule of water and a syringe and a needle. You can provide water injections.
Yeah. And then just recently, I'm sure if people have been following some of the sterile water injection sort of feedback on some of the social sites, there was a fair amount of pushback where it seemed that, I mean, for all intents purposes, I saw some of the feedback and I was like, are people really understanding? Are these just people that don't know? People don't know what they don't know. Um, you seem to take it really well. Nigel, you seem to take that information very well, but you had people that really did review it who weren't involved or engaged with you, who are sort of outside of your network, who really did give positive feedback after they reviewed the research as well. That must have been pleasing to you as well.
Oh, it is. It's always pleasing when you get feedback, particularly from peers and people who've as I say, are generally outside, and read our research and appreciate the effort and the robustness of the results as well. But as you mentioned, we did get this degree of pushback, particularly from the recent guidelines update in the UK, that produced a fairly sort of negative response. And I think that was for a number of reasons, which we kind of explore within the presentation as well.
Yeah, yeah. I thought it was interesting too, and I think that it would be such a great conversation, just to sit with my peers and try and sort of work out, what exactly was going on. Where can we go from here in terms of what are you looking ahead to with now this research? What would you like to do? What are you doing in terms of, either promoting it or just seeing it moving forward?
I think what we're looking at, particularly over the next few years, is trying to expand the scope of water injections.
Mm,
So not only looking at kind of mitigating again away from that one side effect of the injection pain, but also using it for other uh, conditions as well. We've talked in the presentation about the research around renal colic. We've got some implementation work we'd like to do about, okay, how does that sit within the treatment of renal colic? Because renal colic is the most common kidney complaint in pregnant women,
mm,
and you can't use NSAIDs for them. So they
right.
have to have some other form of analgesia. Generally, we give them morphine, but water injections might actually be better with fewer side effects. So it's really about sort of, okay, how do we actually implement that within that particular condition as well. So that's some of the work that we're looking at going ahead with in the future.
Well, that truly is very exciting. I mean, any time that you can reduce any type of pharmacological, or, and again, it's the option. I always think about
Mm.
the, let's have more options. Informed decision making is such a key thing, when it comes to the autonomy of, pregnant people's bodies, women's bodies. It's so important. So I'm certainly excited to hear when that research is ready. That would be fantastic to hear from you, of course, Nigel. Well, thank you so much. Your dedication to this area, the research, the continuation. I don't think that you've been held back. I think that you've continued to, supply us with some really robust research to look at what we can use. And I'm really hoping that this will continue to help people think about how they can get policy, because it's policy that you'd love to see in place, because there's a little bit of
Yes.
fear behind this as well, right?
There is, and it's always, it's one thing to kind of produce the research and that demonstrates the effectiveness, but there's always that kind of leap to get it into policy,
Hmm.
um, and to really, kind of get over that sometimes that almost knee-jerk reaction of negativity to then get the guidelines out there, and they're what we need to actually help propagate the procedure amongst healthcare providers.
Yeah, absolutely. Well, thank you again for being here today. You certainly don't want to miss out. For all of you listening in right now, there's a great way for you to come and join us. You can head over to goldlearning.com right now. This will be for our Gold Labor and Delivery Symposium series. I'm so excited. Nigel Lee will be here with us talking about sterile water injections for managing back pain in labor, evidence, techniques, and implementation. Thank you again for being with us here tonight, Nigel. It's been great chatting with you.
All right, thank you.
Yeah, we'll look forward to seeing you again. Thank you, everyone, for joining us. And tune in again for more information and opportunities here at Gold Learning. Have a wonderful rest of your day, everyone. Bye bye for now.